You know, most of my working career, this is like my second career of my life, was in retail management. I managed a drugstore, I managed a grocery store. My wife's a nurse, and she finished her schooling, finished her master's, and then she's like, you know, you should go back to school. And, and she's suggested the role of an RT, and she's thought that my personality would fit in that role. So after some research, we planned, and I went back to school, and at 45, I became an RT.
Well, I've been here for March will be 12 years, but I originally worked as a phlebotomist. So I did my schooling, became a respiratory therapist, and in March it'll be 6 years that I've been an RT. I feel like in respiratory therapy, not a lot of people know what we do. Everyone always refers to everyone that works at bedside as nurses. So when COVID hit, everybody knew who we were and what we did and how much we helped during the COVID times.
When we first started, we thought that the big issue was going to be ICU beds as such, or ventilators as such. What we really realized is that it's all about staffing. It's about having nurses and our RTs who can take care of patients.
I do enjoy working here because we're a family. I even have some respiratory therapists that I went to school with, which was over 13 years ago. We started everything together, and we're still working here.
Here in the NICU at Community Regional Medical Centers it's a lot different than other places. In our NICU, we're more hands-on. We make a lot of decisions that other places don't. A lot of places are just button pushers, I guess you would say. Here we actually make a difference, and we're a part of the care team.
The biggest thing about respiratory is that every day there's something different. Every day, and especially in this hospital, you're learning something new. Respiratory here you're part of the team, you're a valued part of the team, and your knowledge and expertise is welcomed and sought after. And every day you feel like you're needed.
One of the biggest selling points for coming here to community is the growth opportunity. Just like everyone else, I wanted to come to a hospital and grow as an RT. Of course, you got to get your foundations down correctly, and so I found that community medical centers is a great place to establish your foundation as a respiratory therapist.
Well, just the hospital in general, you know, we're expanding. We have a lot of things to offer. We have a great team. We have great ICU doctors and floor doctors as well that, you know, great with communication and let us kind of use our critical thinking skills as well when it comes to our own patients.
Here we get the sickest of the sickest. Any other hospital that cannot care for their patient or provide the level of care we can gets shipped to us. If I were to work elsewhere, I would never be able to use the skills I have that I got from here anywhere else. They would be limited. So it's just a continuing learning process for myself and for everybody.
I wanted to make a difference. I wanted to have hands-on with the micropremies, and then it's just, since I've been here so long, it's just an awesome feeling when you see these babies after they're sent home thriving outside of the hospital.
We talk to each other, we learn from each other. Our RTs have always been so very much involved in the education of our residents and fellows.
It's nice to feel that we're giving the best care, but at the same time, we're able to be there for someone.
Recently, I had a nurse shadow me for my full shift, 12 hours, and it happened to be a very busy day. We had situations come up that usually you don't see in one day, but this particular day, all these situations arose. And at the end of the day, she was like, wow, I never realized how many things that the RT touches in this hospital.
I think what makes it count is the patients and families saying thank you. I think especially during the pandemic, our COVID patients that were on ECMO and that we thought many times weren't going to make it, when they walk out of this place and we get to say goodbye to them, that makes everything else that we have done, all the tiring days, all the lack of sleep, all the overtime, and it's made it all worth it, because when you see that, you see those patients smiling and saying goodbye and getting to see their kids and their loved ones again, it's honestly the best and most rewarding feeling. That means everything to us.